Welcome to another episode of the Student Loan Planner Podcast. I'm Travis Hornsby, and I have to say I'm really excited because my paternity leave is coming up. I mentioned it a whole bunch, so maybe you haven't heard, but I'm super excited. It's going to be our first child, so we're beside ourselves with anticipation. I will say that our team is super awesome. They've come up with a really detailed list of podcast episodes that they want to release themselves while I'm away. So you're going to get a special treat. You're going to have our consultants doing their own podcast episodes for the show while I'm gone. I think that's just going to be so fun just to get to hear some other voices and just to hear some of their corny jokes instead of just mine, right? So we're looking forward to that. Thank you to everyone who submitted the Student Loan Planner Scholarship, submitted an essay for that. So we're going to take a look at those. We're going to judge those. We had a lot of people reach out to be volunteer judges for those essays. So we're going to try to get those decided on and alert the winners for that. So thank you so much for being able to give back to the community, because it wouldn't be possible if we didn't have any profit to do that with. And we sponsor the scholarship basically just ourselves. Some places, seek out sponsors and everything. I think it's very helpful for me to just align my incentives and just to remind myself as the person who started Student Loan Planner, why are we in business? What are we doing? The point of everything we do is to help you. And that's one of the ways I try to remind myself of that is by having a giveaway every year where we try to give some scholarship money and give some free consults away and some free investing course enrollments away. So excited to see who the winners are for that. We've got a bunch of categories to judge, so it might take us a little bit. So today's show, I want to talk about this survey that we did. Many of you filled that out, so thank you if you did that. We asked a lot of questions about, how you're doing during the pandemic. We also asked you about career regret. Did you regret your career choice? So by and large, that's something that about half of all people, if I just from Google sleuthing, I basically found data that said around half of people regret their career choice in general. So that's kind of a pretty large number. So that's not necessarily too out of the ordinary if, you're saying you regret your career choice. A lot of people say that. And there's different variations of career regret too, right? Like some people were like, I'm miserable. This is the worst decision I've ever made. I would say that's certainly kind of the minority of folks. I think probably the more common type of career regret is, oh yeah, if I could do it over again, maybe I would choose something different. But, it is what it is, and I'll just do my best. So I think that's the more common kind of career choice regret that we see. But we're going to talk about the best and the worst jobs right now during the pandemic and due to student loans. So it's kind of two separate things. I think that, during the pandemic right now, people that are having a really hard time probably are more likely to say they regret their career, even though we asked, is it because of student loans or not because of the pandemic, because we asked those in two separate questions. So that's why I thought I'd just call today's episode Best and Worst Jobs During the Pandemic, just to kind of say that this is a snapshot in time. This is what people said. But we did ask specifically, do you regret your career choice because of student loans? And do you regret your career choice because of the pandemic? So we asked those two questions separately. So I'm really excited to dig into that and really kind of share some pretty fascinating data that we found about what determines someone's career satisfaction. But first, I want to go to a listener question. So this listener question comes from C. And remember, you can leave a question, studentloanplanner.com/voicemail. So let's listen to C's question.
Hi, Travis. My name is C. I make about $100,000 and I have a principal balance of $225,000 in federal direct unsubsidized loans. In March, I had about $12,000 of accrued interest and I've been paying off the interest since rates are 0% under the CARES Act. Should I continue paying off the accrued interest while CARES Act policies are in place? Or should I use those payments for other things like investing and savings?
Okay, so my first observation from listening to that was she said that she had $100,000 of income and $225,000 of student loan debt, and she's trying to pay down the accrued interest on her balance. So right away, my mind jumps to the debt to income ratio. So C's debt to income ratio is over 2 to 1. So if you owe $225,000 of federal loans and you have $100,000 of income, you owe more than twice what you're earning. If you maximized your 401k, that debt to income ratio would be even higher, right? Because if you save the maximum in a 403b or 401k, you could knock that 100k income down to about 80,000. And now your debt to income ratio is even higher than that. It's almost approaching 3, isn't it? So that high of a debt to income ratio is very clearly a forgiveness case. There might be some complicating factors. Maybe C is not eligible for pay as you earn. Maybe C is married. Maybe C lives in a community property state. There's a couple things that I would ask if she was a client. But in general, that sounds to me like a forgiveness case, not a repayment case. In that case, if you're paying extra on your loans, it would be the same as if you decided to pay Uncle Sam more taxes than you actually owed. So keep in mind, Vice President Biden is leading in the polls, right? And seems to be the favorite to win the election. And his student loan plan may or may not pass, but his stated goal is to make forgiveness more generous. And even on the Republican side, that's kind of sort of what they're talking about as well, in eliminating the tax bomb at some point, right? So if the goal is to eventually make student loan forgiveness plans more generous and not less generous, then anyone who fits the existing kind of rules of thumb that we have for whether or not you should pursue forgiveness should really consider pursuing forgiveness, especially with what's happened during the pandemic with the unprecedented student loan relief that Congress agreed to. Because what that kind of showed me during this pandemic is basically you don't know what you don't know. I didn't know that they were going to suspend payments and interest and give credit towards forgiveness. That's just mind-blowing that they would have done that and how paralyzed Washington is, right? Which tells me that there are features and benefits of income-based repayment that are unpredictable and are probably more likely to side with helping borrowers versus siding with making more profit for the Department of Education. Now, when they do side with making more profit for the Department of Education, it's probably going to be more incompetence than intentionality. So whenever something screws you over, whenever PSLF was supposed to happen, but it didn't happen because you were in the wrong repayment program, right? That's just bureaucratic incompetence more so than intentional trying to hurt borrowers, I think, in general. I mean, obviously, there's maybe some different situations where you would say that the goal is to kind of hurt borrowers, right? Maybe not, discharging people's debts that went to for-profit schools and were deceived, for example, right? But in general, I think that that's a pretty fair statement to make, is that forgiveness is going to become more generous over time, not less. So, if C had called in and said, hey, I've got 100,000 of student loans and 100,000 of income, and I'm in the private sector, what should I do? Should I be making payments on my loans right now? What I would tell her is, if your student loans are 0%, then you can take $10,000, let's say, and put it in the bank, and you can earn $50, 0.5% interest rate that you'll get on your savings, right? So literally, you make more money putting the money in the bank account, even though the savings rate isn't good or the interest rate isn't good on your savings. You could make more money just literally parking that money in the bank and earning interest and then paying your student loans when the interest comes back. So that's what I would tell people. I'm telling people that have federal loans that want to pay their loans off, don't make any extra payments on your student loans. Paying extra when loans are $0, it feels good to pay when the loan's at 0% because then all of your payment is going towards knocking down the balance, which feels psychologically great. Now, I will say this. Behaviorally, if C was super motivated in watching her balance fall because interest was at 0%, that might lead her to having a higher savings rate, which would give her 100 times the impact of putting her money in the bank and getting an extra 0.5% interest, right? So a lot of personal finance is behavioral. And so that's one thing you have to recognize is how emotionally motivated are you by achieving certain milestones in your personal finances, right? Investing, the S&P is at record levels. So I would say that C should have a regular investing plan, but nothing that's reactive to the fact that the S&P is way higher now than it was, and everybody is discounting the risk that exists in the stock market. Whenever the stock market soars, everybody thinks investing is not risky, right? When the stock market crashes, everybody is thinking, oh my gosh, this thing is so terrifying. I don't want to put a dime in investing, right? So I would say make sure you have a really solid investment plan set up first. So maxing out your 401k, it's going to be about $750 a paycheck, having a couple $100 at least a month going into a taxable brokerage account, having a solid emergency fund. Those all should be priorities before paying down any loans. Now, if C needed to pay the loans, then she would want to probably just put that money on the bank account and get ready to dump it in as a lump sum when the interest deferral is over. In reality, I think she needs to seriously reconsider her strategy because I think she's probably better off going for forgiveness, but instead she's wasting a bunch of money trying to pay her debt back. So it's a wonderful question. And again, if you wanted to ask a similar question, just go to studentloanplanner.com/voicemail to ask that. So now let's talk about the main topic of today's show, talking about the best and worst jobs of the pandemic. If you showed up in the worst jobs of the pandemic category, a lot of people really like their jobs. I mean, even if a huge percentage of people said that, man, they wish they could have chosen a different career if they could do it all over again, a decent number of people, even in the most stressed out job right now, still are really happy with their profession. And, you can't go back and change the past. So it is a little bit of an academic exercise. And I do really firmly believe that even if you regret the decision that you made with your education, you can still have an amazing life and an amazing financially successful life. In an extreme case, that might mean you need to go back to school and get a different degree. And because student loan forgiveness, the payments are the same regardless of the amount that you owe, that's a perfectly reasonable decision if you're that stressed out and depressed about the job you chose. Now, most people just have mild level of regret, right? Most people are happy to just do what they need to do, and they're, happy being in their profession, because it is what it is kind of thing, right? And so again, just a little bit of a change in perspective can really improve your career and make you feel like you made a great decision just by viewing your student loans as a tax instead of a debt. And there's obviously a very real cost of going back to school and spending years in school to do something else. So a lot of people cannot make a change. But ultimately, that's okay, because if you really, really needed to pursue being happy, you can really do a lot of things if your loans are federal. So that said, let's talk about the best and the worst jobs of the pandemic, and also the best and worst jobs for dealing with student loans. So let's first address people that wish they had chosen a different career because of the pandemic. So I'm going to start off with the professions where people really feel like they wish they had chosen a different career because of the pandemic. So overall, we only had 14% of readers that took our survey that said they wish they had chose a different career because of the pandemic. So what is that, like 1 in 8 or something like that? I mean, that's a fairly small number. So people seem to be not especially discouraged overall by the pandemic with their career choice. I mean, it kind of makes sense. I think a lot of people with professional degrees are sort of looking at people that were waiters at restaurants, or people that are working as, in nursing homes or working as grocery store employees, and thinking, wow, honestly, my job kind of feels pretty good right now compared to some of the other jobs that are out there. If you think about professional degrees in general, obviously you're dealing with more economic security. You're dealing with a little bit less, than some of the lower income workers are dealing with right now. So I think that's why that number was so low. When we asked, would you have chosen a different career, because of your student loan debt, we had 43% of people say that they would have chosen a different career because of their student loans. So basically 3 times as many people would have chosen a different career because of their student loans than the pandemic. So, the student loans causing 3x the pain of COVID. I mean, that tells you how bad student loans are, if anything does, right? So let's first talk about the professions. I'm going to say these are the top 10 professions that wish they had chosen a different career because of the pandemic. So I'll go from 10 to number 1. So number 10 was higher education administrator. 15% of people said they wish they'd chosen a different career. Dental specialist, people in the corporate world, nonprofit employees, physical therapists, nurses, dentists. 18% of them said they wish they chose a different career because of the pandemic. Chiropractors, occupational therapists are number 2, and then teachers were number 1, wishing they had chosen a different career because of the pandemic. That makes total sense, right? Everything that teachers are being asked to do right now. Now, the 10 least impacted by the pandemic, or the 10 that reported the highest career choice satisfaction during the pandemic. So I'll go 10 to 1 on this as well. Number 1 meaning the most satisfied with their career choice. So number 10 is IT, 7%. That's it. Veterinarians, nurse practitioners, public health professionals, physicians. Only about 7% regretted their career choice. Psychologists, physician assistants, financial planners, speech language pathologists, and number 1 of the careers that least regretted their choice of career during the pandemic was engineers. Only basically 0% of engineers in our survey said that they had regretted their career choice because of COVID-19. So here's some of the comments that we got. I thought it would be kind of fun to go through some of the comments from listeners just to kind of share a little flavor of what people are going through right now. I'm going to alternate, a profession that is fairly satisfied, with their career choice, with a profession where people are a little bit more dissatisfied with their career choice, just so that we're not going all positivity, all negativity. We're kind of mixing it up here. So one physician assistant said, I was furloughed from my primary care job and was able to find a new job within 2 months. I had to relocate because I was in a rural area, but I love that PAs are versatile. I went from primary care to bariatric surgery, no problem. I look forward to practicing in a number of different career fields during my career. So that's, basically kind of stressing how even in the event of somebody losing their job in the PA world, people were doing pretty well. Let's kind of contrast that with a corporate employee. This corporate employee shared, I'm in event marketing, and COVID has ruined our entire industry. That's an understatement for event marketing. I've taken a 30% pay cut and the breadwinner of my household, and I've had to take on 3 times the work since before because our resources have been cut and there's no end in sight. I don't even feel comfortable going back to school because taking on more loans could ruin us. So, I mean, that's just kind of showing the different levels of stress the pandemic is causing, maybe from an economic perspective. In terms of a little different perspective here, here's a nurse that says, it's a frightening experience not to have adequate PPEs to protect myself and other healthcare workers. My job became a more stressful environment that has taken a toll on me physically, mentally, and emotionally. I'm also scared of exposing my family. And contrast that with a veterinarian, one of the better professions during the pandemic. I feel great with my profession, this vet said. I'm a food animal veterinarian, and I am happy that I'm able to help feed the world. I had a student loan consult to reduce my student loan payment. I have a healthy wife, a curious 10-month-old. Life is really good besides COVID-19. So that makes sense. You know, nurses asked to take a huge toll. You're either dealing with a ton of frontline COVID patient care as a nurse, or you were in an elective field as a nurse and had economic insecurity, maybe even getting laid off, as a lot of nurses did in fields that, you know, were unrelated to COVID, that were more elective, where the nurses just didn't have the revenue to stay employed. And so hospitals, in a lot of cases, just laid nurses off to pay them through the unemployment program. And that was very difficult, especially if you're used to stability, right? Veterinarians obviously were not super affected by the pandemic from an economic standpoint. You have demand that actually skyrocketed during the pandemic. Just kind of one example. I mean, my brother got laid off from Disney World. He made a lot more on unemployment than he did from his primary job. Their dog got sick, and because of those stimulus checks and because of that enhanced unemployment benefits, you know, they had a lot of time and they had knowledge that the dog was very sick. And so they took the dog into the vet, and because they had that money, they were able to pay for a very expensive treatment to make the dog healthy again. So that's kind of just an anecdote, but I think that, you know, veterinarians economically have been stressed for a lot of reasons, but overall in the pandemic, veterinarians are definitely one of the professions that are big winners from this pandemic, economically speaking. So here is our most negatively impacted by the pandemic, according to our survey of 3,000 readers, was teachers. And so one comment from a teacher, which is really, I think, a great comment to kind of tell you what the teachers are going through right now. This teacher says, when Corona hit in March, we were forced to go online. Teachers were praised for their efforts. Now we're considered lazy for trying to be cautious and protect ourselves and our families for not wanting to go back to school. A lot of teachers, myself included, are expected to teach face-to-face while simultaneously maintaining virtual courses for students in quarantine. We are mentally and physically and emotionally drained due to Corona. Makes a lot of sense. From an engineer, this is basically the career that reported the least regret choosing their career during the pandemic. So this one engineer said, I chose an industry in biopharmaceuticals that has been incredibly resilient and even thriving in the pandemic, for better or for worse. I did not think of this when choosing a career, but have been grateful for the stability and growth opportunities during this time. Actually, my income has gone up 50% since COVID started. Wow. There's definitely some professions that are big winners and losers during this pandemic. The good news is this is not going to last forever for the folks that are kind of dealing with a lot of economic frustrations. But it's very fascinating to see the fields that we thought were stable ended up becoming less stable. Fields that were praised for their work-life balance and flexibility became a lot less so. You know, a lot of these fields too, like people that were on the front lines, are not getting bonuses or not getting any excess pay. They're sort of just keeping the pay level that they have. And it's just creating all kinds of distortions. I mean, I will say one example of this, and obviously my wife's pay has been cut a lot now, but back in kind of April timeframe, there were a lot of physicians in her division that were having to go in to do, you know, emergency sort of deliveries, right, for babies that were being born. But she was doing basically only telehealth and no surgery. And so, I mean, across the board, you really had a lot of folks, like some people having to do a lot of physical work and expose themselves to Corona for the same kind of pay as somebody who wasn't being asked to do that. And it's just kind of creating all these different unexpected incentives that are just putting all kinds of strain on people. So just pretty interesting. So when we looked at these best and worst jobs during the pandemic, what we kind of found are a couple themes. So the things that really mattered to people was people really mentioned this in the comments a lot, that the ability to work remote was a huge impact on their quality of life. So a lot of people in some fields basically reported feeling regret that they didn't sign up to do an occupation where they could work anywhere. And I think that's just couple things, but the stress of childcare, the stress of having to show up and be more exposed than somebody who's able to work from home. So that was a big thing on satisfaction of your job during the pandemic, was any kind of ability to work remote. The second big theme that we found was people really valued income security during the pandemic. So if a profession wasn't particularly hit hard during the pandemic economically, the people tended to report more satisfaction, having chosen that career. Whereas, some of these professions that were more impacted, certainly reported a little bit more regret choosing their profession. So you think about, dentists, dental specialists were certainly very, tremendously impacted negatively, chiropractors, physical therapists. So, that wasn't the only thing, because you had a couple other professions on there, like, for example, teachers that showed up that didn't really have to deal in a lot of cases with income loss. So it wasn't the only thing, but it was a theme that we saw pretty consistently that, if you lost a lot of income, if your income was very volatile during the pandemic, that was a really difficult thing that people really reported, saying, man, I wish I had chosen something that was a little bit more stable. And the third big theme that we found for the best and worst jobs during the pandemic was having a feeling of meaning during the pandemic. So in other words, public health professionals, physicians doing frontline kind of work, psychologists, all those folks sort of reported, a very low level of career regret. And a lot of the people in the comments talked about how they felt so grateful that they were able to contribute during this time, that they felt grateful to be useful, comments along those lines, right? And I think that when you were asked in some other fields to not do your job because of exposure to COVID and because of the risks of, kind of spreading the disease and everything, or the virus, that was really hard on people from a mental standpoint. As stressful as it has been to be a public health professional or a physician or a psychologist or some of these other fields, at least, from the comments, we saw a consistent theme that people really appreciated feeling like the work they did really mattered. And so that's kind of, you talk about Maslow's hierarchy of needs. The number one need is self-actualization, which is basically feeling like you have, that you have meaning, right? That what you do has meaning. And so we saw that present in the survey with people's satisfaction levels. So I want to talk too about the other big question we asked in the survey, which is, what are the best and worst professions due to student debt? So when we looked at this, we kind of asked, do you regret your career choice because of your student loan debt? And we had a top 10 jobs for the highest level of regret due to student debt and the top 10 jobs for the lowest level of regret for student debt. I'll go 10 to number 1 for most regret due to student loan debt. Okay. Number 10 of the most regret for student loan debt was optometrists. 50% regretted their career because of student loan debt. We had pharmacists at 52%, teachers, public health professionals, counselors and therapists, nonprofit workers, physical therapists were number 4 on this list. 57% regretted their career choice. Chiropractors, veterinarians were number 2 at 58%. And number 1 that regretted their career choice the most because of student loan debt was occupational therapists at 67%. 2/3 of the career regretted choosing it because of student debt. The top 10 that regretted their career choice the least because of student loan debt, nurses were number 10 on this list at 39%. Then we had dentists at number 9, IT professionals, psychologists, government employees, dental specialists were number 5. Only 35% regretted their career because of student debt. Engineers, number 4. Physicians were at number 3. Physician assistants were number 2. Only 23% regretted their career choice because of student loan debt. And number 1 was actually financial planners, which 10% reported regretting their career choice because of student loan debt. So if we think about those occupations, what does that mean? So we're going to, again, go through some of the comments and just talk about some of the professions that did regret their career choice more than average. And then we'll talk about some occupations that regretted their career choice less than average. We actually looked at almost 400 careers in total. We did have to have a big enough sample size to say that it was statistically significant in the survey. So that limited things a little bit. But this analysis here, we had a dentist who said dentists were one of the professions that, regretted their career less because of student loan debt. I was a little surprised by that because we know that dentists, are a group that has the most student loan debt on average of any profession. And yet they reported significantly less than average regret about choosing their career. And one of the reasons, this one dentist said, dental private practice ownership is still a very effective way to earn income and ultimately be debt-free. I would not feel this way about corporate dentistry or if I had to be a long-term associate. So that's an interesting sentiment. basically the ability to earn a lot of money, even though you have a lot of debt, that kind of superseded, it seemed like, the student debt that people had to borrow for dental school. Optometrist was one of the top 10 worst for student debt regret. And one of the comments was, the average income for an optometrist in the Midwest is $100,000 and has remained that way for 5 to 10 years, even though tuition has increased dramatically in that time period. I would have gone to PA school if I could do it over again. 3 years versus 4 years, high income, and significantly less loans. So that makes a lot of sense, right? Optometrists, you have to train longer. In a lot of cases, you make less money, a little bit less flexibility. And so this person's kind of saying, well, if I could do it over again, I would have gone into PA school instead of optometry school. And PAs show up pretty high on that list of not regretting their choice because of student debt. Again, I think that is because the debt to income ratios are a lot lower for PAs. The incomes are very similar to veterinarians or optometrists, but because they do 3-year programs by and large, I think some programs might even be like, 27 months or something like that. You can really keep the debt down if you're really careful as a PA, whereas that option is really not available to you in a lot of cases if you want to be a veterinarian or an optometrist. So it's kind of interesting to kind of see that those different debt to income ratios within each profession. It's kind of why I see that data, and I think vet school and optometry school shouldn't be 4 years. And it's not because maybe you don't need to learn that material. It's not because that would be really difficult to do. I mean, if you think about Pacific Dental School, they do a 3-year program. They charge the same amount as a 4-year program. But if you had a school that could try to pack in everything in 3 years, and perhaps there would need to be some sort of certificate program or some sort of baccalaureate, like undergraduate level kind of course or degree program that students could take to get prepared for school. I mean, why aren't higher education accreditation bodies talking about this? What's the downside of using the centralized nature of the American Association of Veterinary Medical Colleges, right? Why can't they come up with a $5,000 certificate program that takes a year that somebody could take alongside their senior curriculum or something like that when people are partying and drinking beer in a lot of cases anyway? I mean, not everybody, but, I'll admit that the last semester of senior year wasn't particularly productive, right? So, why not try to figure out what kind of prereqs that there's just not enough space for within 3 years and see if we can offload some of that into some other way and get creative so that we can keep some of these debt balances lower. I mean, there's just no interest at all in being creative and trying to help students at the college level. It's all about how do we do degree creep and how do we force people to go to school even longer, so that we can get even more money and even more revenue instead of helping students, and then they sort of hide behind, well, we can't possibly do this, in 4 years. Well, you know what? In World War II, I mean, people were graduating a lot faster than they were normally supposed to graduate at. And they did it because we had to. And the student debt crisis is so bad in this country. I think we're at the point where we need to have conversations about things that just need to happen no matter what, and then go figure out how you do that. I'll probably rant a little bit more about that at the end of the episode. So let's keep talking about what some of these occupations said. So a physician, which was in the best of the 10 jobs for student loan debt, minimal regret. One physician said, most physicians thankfully still make a decent amount of money and are eligible for PSLF. We generally have jobs, a good job security, even in a recession or a pandemic. So true. Physicians, only 1% of all physicians reported losing their income completely at any point in the pandemic. 56% of dentists reported losing their income completely during at one point of the pandemic. So, basically in the worst public health profession of all time, in the worst environment, or at least, in the 21st century, in the past 100 years, I should say, right? Because 1918 was probably worse. But if we think about the economic losses that healthcare systems experienced, they were awful, so bad, right? And yet physicians, by and large, did okay. Now, a lot of the nurses got laid off. A lot of the support staff got laid off. A lot of physicians had, 401k match suspended and had pay cuts. My wife had a 30% pay cut, 40% if you include the cut in her 401k match, right? So extremely severe pay cuts that physicians had to deal with in some cases, but very, very few physicians actually lost their jobs completely. I mean, that's really kind of a valuable thing in a pandemic. And with student loans, physicians have access to PSLF. One of my kind of first articles that I wrote for the blog was how a neurosurgeon can pay less money on their loans than a nurse or a veterinarian or something like that. I just compared them to somebody who makes, 1/5 to 1/10 the income, right? You would think that the person that makes 1/5 the income would be paying less on their student loans under an income-based plan. But because, someone like a neurosurgeon might go for training for 7 or 8 years, and then because the payment based on your income is always based off of the prior year tax return, most like neurosurgeons pursuing PSLF would literally only pay based off of an attending salary for one single year, pretty much, out of the 10 total. So if you manage PSLF the right way, you could literally pay around like 40 or 50,000 for your student loans over 10 years as a neurosurgeon. Whereas, somebody who's making, 60, 70,000 as a nurse right away, she might not even get the ability to get student loan forgiveness on her debt because maybe her payments are already kind of close to that standard 10-year plan. So PSLF really does warp a lot of things. Physicians have it. Physicians are going to keep it, especially because of the stress that everybody went through with the pandemic. And so PSLF is here to stay. I don't think that PSLF is going to get expanded to dentists and veterinarians and lawyers and some of these other people that are not in public service, defined as not-for-profit or 501c3 jobs, right, or government jobs, right? I will say one kind of fascinating thing is religious workers are now eligible for PSLF. With new guidance the Department of Education just issued, you can now get PSLF as a pastor or rabbi or imam or cantor for a service. It's kind of interesting. So I guess there's a little bit of expansion that's happened with PSLF in terms of who can qualify. But physicians have it not from a stress perspective, right? Not from a burnout perspective, but from a, loan and income perspective. Physicians are probably one of the top 2 or 3 professions of any profession financially still. Yeah, you'd probably be better off going to work at Facebook as a software developer right out of school. But I'm comparing physicians to other people that have to have a graduate education. And physicians are, very much protected from income loss, and they have a very guaranteed ticket to a stable upper middle class life if you punch it. You either probably go private practice and make enough money to pay back the debt, or you go PSLF and get the debt forgiven tax-free. So either way, you have a super clear path towards dealing with your loans. In most cases, that doesn't involve having to kind of gamble and keep your loans around for 20 years, which is not the ideal by any stretch of the imagination. So let's compare that to a physical therapist, which was in the list of the worst 10 for student debt regret. One physical therapist said, "My debt to income ratio is seemingly impossible to overcome. I don't feel like PTs have the respect associated with being a doctoring profession, and that combined with poor pay and high debt levels leads to feeling burnt out and down on the profession as a whole overall." Just a quick thought about that. The physical therapist profession is a classic example of schools acting for their own interests and not giving a damn about the students they serve. And the reason I feel that way is because the Vision 2020 statement basically required physical therapists to get doctoral degrees instead of just being able to do master's degrees for their jobs. And theoretically, if the schools had been out there making sure that, government reimbursement, insurance company, Medicare reimbursement rates were going to reflect being, a doctor with that level of education getting reimbursed, then maybe that would have been a smart thing to do. But what ended up happening is they required everybody to get a doctorate degree, and reimbursement rates really didn't change all that much. And more schools popped up because of the amazing revenue that they could salivate over with getting students to sign up for their degree programs, right? So you had this explosion of PT programs, way more new grads. So you had way more supply than you probably could absorb with that level of high income that existed with PTs. And then you didn't focus on fixing the reimbursement rate problem. You just paid lip service to it and just said, oh, we're working on it, when you're not really going to have a solution for it. And so now PTs make the same amount of money they've kind of always made, even less in some cases because of the stress and the competition going on. But the problem is now you have way more debt, right? So you have way more debt and you have a limited, just a fixed income that didn't change. So I'm not surprised. And, because you haven't gotten that higher reimbursement rate and that change in the amount of money that people are being reimbursed for procedures, a lot of times, what do people respect? Well, they respect professions that have a high degree of autonomy that make a lot of money, right? So physical therapists don't make nearly as much as a physician or a dentist practice owner. And I think that leads to a lower level of respect, perhaps, and not viewing physical therapists as a doctoring profession because the money didn't follow. So that's some of the thoughts there. A PA, we mentioned them kind of having a higher satisfaction level because of the pandemic. They were also one of the higher satisfaction levels for not being regretful over their student loan debt. One PA said, choosing to be a PA is still a very good decision. You have very low unemployment, increasing salaries, increasing job scope, flexibility of specialty, and high responsibility. If you pick your career path wisely, especially targeting PSLF, you can pay off your loans in short order, even pay less than your principal over 10 years, all while doing community service. Good point. A veterinarian, however, was the number 2 job for the most student loan regret. One veterinarian said, "I love my job, but stress associated with being a vet in society with lawsuits, social media harassment, general public entitlement, Dr. Google, and the debt burden are not worth it. There are other jobs I would have been able to find passion in without the added compromise to my well-being." So that's very true. The amount of debt that vets are asked to sign up for, essentially physician level debt, right? You're really asked to take on the same debt as a physician for, much, much lower pay, and dealing with customers that are extremely emotional and might not respect you as much. So if you go to the doctor, right, some people think this, but by and large, you're not going to get as many people saying, oh, you just want my money, right? Whereas you come to treat your pet, and, treating your pet is something that there's no, Medicare for all for pets. You have to pay. If you want to get the pet healthy again, you have to pay for that because there's costs associated with treating the pet, right? So it's consumer discretionary. And sometimes consumers, they'll harass veterinarians right and left. They'll say, "Oh, you just want my money. Why can't you do this for me? I'm a low income person. Why can't you cut me a break?" And they just don't understand the cost of inputs of providing the care for their pet. And so I've heard stories from veterinarians that people will go out and post just a bunch of 1-star reviews, and they'll review bomb a vet practice just because, they're mad because the veterinarian won't agree to treat their dog for 50% of what the medicine and surgery materials cost to treat the dog. Right. So, I think that the veterinarians get kind of bitter towards that debt because if they didn't have the debt, maybe they could at least live a little bit more unburdened life. But with that giant debt, it just feels like people have been misled. Right. So now what we're going to do, we're going to talk about the best profession for not worrying about student debt and then the worst profession. So the best was, people said, financial planners. One financial planner said, "I feel like financial planning provides so many ways to make money and help people in the process. I enjoy the flexibility of my job, which allows me to spend time with my family. My husband is a doctor and does not have that type of flexibility with his job." So financial planning is not a profession that requires an advanced degree to practice. So, maybe I shouldn't have included it in the list. I did just because I thought it was kind of interesting because people talked about flexibility. You can make a lot of money, be a business owner, help people. And I think that very telling, just because you have an advanced credential that's required doesn't necessarily mean that you're going to be brilliant at doing it. So financial planners kind of have the CFP, which is an advanced credential, and it takes some time to get it. But, imagine if the CFP was a graduate degree that was required of people to get. So currently, a CFP as a credential, you can simply pay a couple $1,000s and go through basically an equivalent of 1 semester course on financial planning or 1 semester list of courses on financial planning. And you can then sit for the exam. And if you pass, then now you're a CFP. And, maybe you don't want that for people's health because, it's a little bit more extreme if you make a mistake, right? But I don't know, making a mistake with people's finances is pretty extreme. And so what happens is financial planners tend to have their undergraduate degrees and they have the debt from that alone. But then as a CFP, they have their credential, and the credential is something that they don't have to borrow massive amounts of money for because they can simply pay a few $1,000s to their professional group, the CFP board, and get their credential that everybody respects. So I think that, that would be a much better kind of way to do things, in some level. Is there a way to carve out like mid-level providers that do more limited scope of things, but maybe only have to get the equivalent of a CFP or some sort of credential that they can study for, maybe get actual hands-on experience for? The government spending trillions of dollars on the student loan system. I kind of wonder sometimes, the government funds residency programs for physicians, which allows them on-the-job training. Why don't we think about funding residency slots for physical therapists or, occupational therapists or some of these professions that are super stressed out so that they don't have to go into a bunch of debt and they could at least learn skills. And again, you can maybe do that for the mid-level providers. And then maybe, the people that are wanting to do the complex surgeries, the complex procedures could still go into school. And maybe you're listening to this and thinking, golly, this Travis guy is a total idiot. I respect that. I definitely could be saying a lot of stupid stuff right now because I'm not in your profession. I'm not, somebody that understands what the accreditation requirements are to get a degree. It takes years to get. I'm just simply saying there's got to be a better way to do it than the way we're doing it now. One occupational therapist, that was the top most regretful profession due to student loans. this occupational therapist said this. She said, the ROI of occupational therapy is poor. I have animosity towards my profession in college at times. In graduate school, I had a professor tell us we would start out making $30,000 more per year than any OT I've ever spoken to ever. Most won't ever make what they report. A lot of emotional and physical sacrifices for this profession for minimal payoff, and it affects my overall mental health and well-being. So I think that I've heard this. Golly, I have heard something similar to that from people more times than I can count. I've heard at least hundreds of people tell me that I signed up for this school. The admissions department told me I was going to make this. I found that the average starting earnings when I graduated were 20,000 less, 50,000 less, right? I found out that the idea that I would pay off my student loans in no time was a bunch of BS. And so one of the problems I have with colleges and universities today is there's zero regulation, right? I can tell you that pigs are blue and they fly, and that you should invest in flying blue pigs. I don't know. I'm just making something up. And I don't get in trouble for that. As a university administrator, as an admissions office, I can literally tell you the sky is pink. I can tell you that, and I don't get in trouble at all. If I'm a financial professional, if I'm a lawyer, and I do something like that, it's called malpractice, and you can get sued over that. Whereas colleges and universities, for whatever reason, can just make up a bunch of horse manure, and they don't get in trouble. And it's ridiculous because they make misleading statements to try to induce you to make an economic decision, which is fraudulent. So in other words, they'll tell you, now's the best time ever to be a dentist. They'll tell you, you're going to make $100,000 going to this chiropractic college, no problem, right? They'll tell you, salaries you're going to make $150,000, and maybe they had one person that made $150,000, and so they're telling a group of 100 people they're going to be the top 1% salary earners. So they just make misleading statements in a lot of cases, and it really pisses me off because I started Student Loan Planner because I care about you. I care about the people that are facing this daunting ridiculousness of student debt in America. I don't have a lot of partnerships with schools. I do have some. Because I do think that at the end of the day, like if somebody is a vice president of whatever at like high cost U, they're not a bad person. They're a good person. Like they're just operating within the screwed up system that exists, right? So I love helping colleges and universities try to get a clear financial plan to people. But my ultimate goal, my ultimate kind of person that I'm trying to please is you. And if other, if programs hate me, if universities hate me, so be it. Because that's what's happening as you're just seeing no regulation at all. And what happens is when you have a high level of federal government involvement in higher education, but a lack of regulation, I think you can't really have it maybe both ways. Like you kind of have to have no government involvement or limited government involvement in higher education where schools would be forced to charge what the people could actually finance. Now that would be a problem because people from low-income backgrounds, underrepresented communities of color would have a harder time accessing education. So that's not necessarily the solution. But if you have the high-level government involvement with no regulation, then people can take all the money and can take unlimited sums of dollars and tell you to borrow as much as they want you to borrow without any accountability whatsoever. And that's kind of what's happening, I think, with some of the professions that we saw. At the end of the day, I just want schools to be accountable, and I want schools to be in trouble if they lie to people. And it happens a lot more than people realize. And it's not just for-profit schools either. I get mad at the Republicans for not being very aware that for-profit schools really damage people's finances a lot more, I think, than they help. That's the problem is at the end of the day, these for-profit schools are not, they're just kind of taking advantage of the easy money trough to try to convince people to sign up. And it's just not overall, I don't think for-profit schools are a helpful part of the education system. Likewise, I get mad at the Democrats when they don't talk about not-for-profit programs and how screwed up those are. You really don't see them talk about how ridiculous a lot of these not-for-profit programs are that in some cases are even worse offenders in terms of the abuse that they're meting out financially to their students overall than for-profit schools are in some cases. You can debate that, right? Is it worse to give somebody with a high school degree a useless part college completion with $10,000 in debt that they can't pay back? Or is it worse to give somebody $600,000 of debt from dental school? Well, they'll make a good income and they'll pay with an income-based plan, but they're offloading the indirect cost of that onto all of us, including the person who borrowed, right? But that money that we're spending on student loans and lining the pockets of these universities, that's money that's not going into fixing healthcare in America or infrastructure or other really important goals, early childhood education. So the key findings that I found overall with the best and worst professions during the pandemic, these are the three big themes that I found with student loans, like people saying they regretted their career because of student loan debt. So people that had a hard income ceiling reported a lot higher levels of regret due to their student loans, regardless of the amount borrowed. So in other words, if you're a dentist or you're a dental specialist and say you have a $600 or $1,000 student loan burden, at the end of the day, I mean, if you could make anywhere between 100 and 300,000 because you could become a practice owner, move somewhere rural, get a lot more money, maybe you go your residency program in, orthodontics is going to give you the possibility to make maybe as much as 400 or 500,000. At the end of the day, if you feel like your life isn't constrained to you can only make this much, people love that, and people are willing to borrow basically anything for that. But people that borrowed for more predictable incomes like pharmacists or physical therapists or occupational therapists, where it's a little bit harder to make massively higher incomes from being a practice owner, people really did not like that hard income ceiling. So that's kind of an interesting take, is that if you are going to go for some sort of kind of limited income ceiling program, that's something that you would really want to consider before you commit to that, I think, just because, and I also think that's a higher calling for those schools to try to figure out a way to get the cost down, because people are reporting a lot of regret for that. Now, number two kind of big theme we found is people that reported a low level of regret due to student loans had a clear path to loan forgiveness or dealing with their debt. So for example, physicians, they could get PSLF, they can pay off their loans if they're in the private sector. It's pretty straightforward, right? But when you graduate from chiropractic school and you have a lot lower income than they told you were going to get, and you've got 5 times as much in debt that you have in income, you're looking at that and you're thinking, oh my goodness, like, what do I do? And then the schools can't give you a good answer, because if they were super sophisticated in the first place, they would have told you the truth about why it's not a good idea to go to a program that costs 5 times as much as what you earn. So that's kind of the catch-22. Now, the third big theme we found for people reporting high levels of satisfaction with the student debt that they borrowed, you need a quicker path into earning a good income. The faster the path to making the money, the happier people seem to be. So, I mean, that's not 100% true, because, obviously you have physicians who have a delayed path to making big money, but things like PAs, folks with shorter kind of training programs reported a little bit higher satisfaction, it seemed like, with their decision to borrow for student loans, which again kind of brings me back to my point from earlier as to why I think that there's urgency in getting to a system where we can figure out ways to accelerate and shorten the length of professional school. I think that would be really important for a variety of reasons. But I think that, it's so important. Show you the hypocrisy. I remember there was a Fix the Debt summit among the key stakeholders in the veterinary medicine community, and they did discuss shortening the pathway to become a veterinarian, but they were only willing to talk about it from the perspective of, well, maybe we can shorten undergraduate. Maybe we'll shorten that. We're not going to get creative with our 4 years of vet school. We refuse to do that. Right. And why is that? I mean, there's definitely reasons of needing to have competency and needing to make sure you cover all the material you need to cover. Don't get me wrong. But I think it's also kind of a statement of, well, we're happy to accommodate what you're asking for, but as long as it doesn't affect us, as long as we don't have to take any income hit, as long as we don't have to cut our costs, as long as we don't have to consider, declaring bankruptcy after building $500 million expansion of our vet campus. I think UC Davis did that recently, right? As long as, we don't have to do that, then, we're open to discussing things that don't affect us. So I think that, eventually you got to regulate these schools. You got to put caps on the borrowing that they are allowed to put students into, and then figure out a way to also preserve accessibility for students that are underrepresented, low income backgrounds, to make sure that those students don't get negatively impacted, because we certainly don't want to go back to a world where, higher education is mostly the domain of disproportionately male and disproportionately white students. That would be a tragedy. So we need to keep that in mind, with also realizing that the discussions that I've heard with student loan reform across the board from Democrats and Republicans are just lousy, because none of them really focuses on the key problems that would happen with any reform proposals that have been put forward. And again, the main problems, again, that I see is the Republican plans don't focus enough on access. You have to have access so that, you have that pathway to economic mobility for everyone. And then the Democratic plans don't focus at all really on cost, which again will crowd out other really important progressive priorities like investing in healthcare, education, infrastructure, things like that. I don't know. There's not an easy solution. Otherwise, they would have already figured it out. But those are some of the best and worst jobs for student loans in the pandemic right now. I hope you're entertained. I hope you've had some fun listening to this. Hope you've tolerated my rants a little bit. We'll have a couple more episodes here before paternity leave, and then I'll be taking a break from my high horse and just focusing on, I guess, becoming an expert. I'll be an expert in two things: student loans and changing diapers. That's the goal. So take care. Have a wonderful rest of your week, and have a happy upcoming Labor Day weekend.